Hi all, in this video I'm going to introduce a completely free online tool that is designed to improve efficiency of emergency veterinarians or any other vets who manage pets with diabetic ketoacidosis or hyperosmolar hyperglycemic syndrome. To access this tool, go to vetemcrate.com and click on DKA Calculator variable rate insulin infusion. The calculator page consists of three sections. In the top section, you can enter your patient's parameters and choose desired fluid composition and fluid rates, which we'll talk about in more detail in a moment. The middle section contains two tables that will guide your potassium and phosphorus supplementation. And finally, the bottom section contains essential information about the calculator itself, insulin infusion, osmolality, phosphate, and potassium supplementation. All right, let's try out this calculator by using a very specific example. Imagine that you are presented with a 13-year-old castrated male domestic short-haired cat that weighs 2.72 kilograms. The owner's main complaints included worsening lethargy and weakness. He also had been recently diagnosed with diabetes mellitus and was started on insulin glargine at 1 unit once a day. The physical examination showed severe dehydration, obtunded mentation, hypothermia, and low body condition score. The point-of-care blood work revealed the following findings. Blood glucose is 550 milligram per deciliter or 30.5 millimoles per liter, so it's elevated. Creatinine is elevated at 2.23 milligram per deciliter or 197 micromoles per liter. And BUN is 41 milligram per deciliter or 14.6 millimole per liter. So this cat is azotemia. His venous blood gas showed the following results. His pH is low at 7.093. You can see the normal range in the parentheses. His partial pressure of venous CO2 is low at 24.3. His bicarbonate is low at 7.5. His base excess is low at minus 22.5 millimoles per liter. He had normal sodium at 150, low potassium at 3.41, normal chloride at 114.3. His phosphorus was slightly low at 2.6 milligram per deciliter. His lactate was elevated at 4.5 millimoles per liter, and his anion gap was elevated at 31.6. You can see the calculation on the screen. In addition, his urine analysis showed high concentration of ketones. There were 3+ if you do the nitroprusside test, and he was ketonemic, so he had elevated ketone levels as measured with handheld device at 3.9 millimoles per liter. Based on the initial diagnostics and the presence of elevated blood glucose, high anion gap metabolic acidosis with ketonemia of greater than 3 millimoles per liter, we can confidently diagnose him with diabetic ketoacidosis, also known as DKA. Since this cat was deemed hypovolemic upon evaluation of his perfusion parameters, he was given a bolus of LRS at 10 ml per kilogram that was repeated once until his perfusion parameters have normalized. Next, we calculated his dehydration deficit that was about 190 mils. You can see the calculation on the screen right now. If we correct this deficit over 12 hours, plus provide maintenance rate and account for ongoing losses, the total fluid rate will be around 26 ml per hour. After he received fluids for about 4 hours, with some potassium supplementation, his blood glucose levels have plateaued, so they were not coming down anymore at about 400 milligram per deciliter or 22 millimoles per liter. And it was decided to start him on insulin infusion. To come up with his insulin infusion protocol and electrolyte supplementation, I used the DKA calculator. First, I entered the body weight of this feline patient, which was 2.72 kilograms. The calculator is designed to use a so-called 3-bag technique, where bag number 1 will be an insulin bag. Bag number 2, it's an electrolyte bag with potassium chloride or potassium phosphate in it. And bag number 3 is the dextrose/hydration bag. So first, we're going to set up the insulin bag. Here, we choose the volume of the bag, syringe or burette, depending on your preference. In my case, I will mix insulin in the 250 ml bag of normal saline, and I will choose the type of fluid here. This bag will run with the maximal rate of 10 ml per hour, which will provide insulin infusion at 0.1 units of regular insulin per kilogram per hour. The next bag is the Electrolyte Supplementation bag. Here, I'm also going to use a 250 ml normal saline bag that can be mixed with both potassium chloride and potassium phosphate at the same time. For the desired fluid rate via bag 2, I'm going to take into account my total fluid rate that I calculated for the cat before, which was 26 ml per hour. Since bag 1 will be running at 10 ml per hour, I have only 16 ml per hour left that I will split between bag 2 and 3. Therefore, my 3 bags will be running at the following rates: bag 1 at 10 ml per hour, bag 2 at 8 ml per hour, bag 3 at 8 ml per hour, so the total rate is 26 ml per hour. So if we go back to bag 2 in the calculator, I will put 8 ml per hour as my desired rate via this bag. Next, I'm going to enter the phosphate supplementation rate based on the table 2 recommendations located below the calculator. I know that my patient has serum phosphorus of 2.6 mg per deciliter, which is considered mild hypophosphatemia, and the recommended supplementation rate is going to be around 0.01 to 0.02 millimoles per kg per hour of phosphate. In this case, I will choose 0.015 millimole per kg per hour that I will enter in the calculator. It is important to note that the online calculator is programmed to use K-phos or potassium phosphate solution with a concentration of phosphate of 3 millimoles per liter and potassium of 4.4 millimoles per milliliter available in the United States. Next, I'm going to enter the potassium chloride supplementation rate based on Table 1 recommendation. Since this cat's serum potassium is 3.4 millimoles per liter, I will enter 0.15 milliequivalents per kilogram per hour in the calculator. All potassium chloride calculations are based on the KCl with potassium concentration of 2 milliequivalents per mil available in the United States. Finally, we need to set up the bag 3. Here, we're also going to choose a 250 ml bag size. However, I'm going to use LRS instead of NaCl 0.9% since it is a balanced crystalloid solution that may be a better choice in patients with severe metabolic acidosis. As we discussed before, I'm going to enter 8 ml per hour as my fluid rate for bag 3. Once we entered all information, we're going to hit calculate, and the calculator will give you the final results that include the recipe for all bags, as well as the sliding scale with variable insulin infusion. In this table, you can find multiple columns. The first 2 columns indicate a patient's blood glucose concentration in milligram per deciliter or millimole per liter. Next is the fluid rate in bag 1 that will depend on the current blood glucose level. Column number 4 is the fluid rate in bag number 2 that contains potassium phosphate and or potassium chloride, in our case both. This bag will run at constant rate of 8 ml per hour regardless of blood glucose levels. It is also important to note that the calculator will give you the final osmolality in this bag, and currently it is 414.2 milliosmoles per kilogram. If your patient does not have a central catheter, this osmolality should be below 600, which is the case in this cat. Otherwise, it may be too irritating and cause thrombophlebitis. The next column gives you the rate of fluid running by bag 3. The rate will vary depending on the bag 1 rates, so that the total fluid rate is maintained at 26 ml per hour that we calculated in the very beginning. Here are the instructions on how to mix different additives to make bag 1 with insulin, bag 2 with electrolytes, and bag 3 with dextrose. All these instructions and the sliding scale can be easily printed by hitting the print button over here, so that it can be given to the ICU technician as a patient order. All right, I hope you will enjoy using this free clinical tool in your daily practice. If you want to learn much more and receive personal mentorship, go to the Veterinary Academy at academy.veterinary.com/courses. Bye-bye.